Yeah, so I'm Dr. Quayers. I'm a GP from Bristol. I've been a doctor for 14 years now and a GP for 9 of those years. And
Alhamdulillah.
I only actually signed up to Instagram last year after the pandemic began, just to try and counteract some of that misinformation out there that we all see and come across.
Yes.
So that was kind of my purpose on Instagram. I'd never ever been on Instagram beforehand. I have on several occasions thought, should I still be on Instagram? But
Yeah.
here I am. And yeah, thank you for organising this live.
No, I think it's absolutely amazing what you're doing because you're putting information out there and people are learning from you. So yeah, it's amazing. And I think this pandemic, we're seeing a lot more people that work within the NHS coming onto Instagram and just educating people, because sometimes you need that relatable content from a doctor who can take off their shirt and be human again. And that's what people want to see on here. So it's brilliant, I think.
Thank you. That's really kind. Thank you. And I think you're right. I mean, I'd never realized there were so many doctors and healthcare professionals on Instagram before I signed up last spring. And it's amazing. There's so many incredible people out there, healthcare professionals and obviously non-healthcare professionals like yourself, going through their stories and experience. And like you said, many people could relate to that. It's more of a personal thing. And
Yes.
hopefully it will kind of counteract that misinformation that we see on a day-to-day basis.
Definitely. I think my story reached out to a lot of the South Asian community because I'd say 85 to 90% of my followers are from the South Asian community. So I was a little bit more relatable from that stance. But yeah, if you've got any questions in regards to how I came about, knowing that I possibly got COVID, then yeah, far away.
It would be really nice actually just to give us a recap, if you don't mind, about what happened and how you had COVID, and then, as you mentioned, please go through everything at the end.
So, I had really gotten ill on the 22nd of December. So that's the date to keep in mind. Prior to that, for a whole 2 weeks, I was getting symptoms of just your average flu. I realized that obviously when I once a year when I do get ill, I don't usually, but when I do, it's really, really bad. I do get, my lymph nodes do actually just inflame up. I ignored it. But I could tell that my body itself was deteriorating. I was feeling tired, slept more, body aches, headaches were crazy, and getting up and down, my head was actually spinning. It came to a point during that week and a half, 2 weeks, where I was having hot sweats, really, really bad hot sweats, waking up and literally having to change my clothes because it's like I come inside from the rain. I thought, this isn't right. I thought, this is not right. I've been ill before. This is something different. Almost, it's as if my bones were hurt, like they were hurting, and any type of painkiller I was taking was not working. So it came to the point where I actually called the ambulance, went into the hospital. I think it was a misunderstanding. I didn't actually stay in hospital, but I was there for more or less the whole night.
Yeah. Can I just ask, so from the time of diagnosis,
yeah,
how many days afterwards did you end up going into hospital?
It was a week and a half.
Do you know what, that's really interesting, because that's probably the kind of average time. We normally see people who are really unwell between about 7 and 10 days onwards.
Yeah.
And that's when often people do end up going into hospital. So that's really interesting you mentioned that.
To be honest, I'll tell you the truth why I didn't do it sooner, because I was frightened and I was scared, and I was trying to tell myself that no, it's not. It's just a flu. It's gonna go. I'm gonna ride it over. It's gonna be fine. And it just didn't. I mean, I know my body, and I know that when I'm ill, I know kind of how long it takes for medication, painkillers, anything to work. I know that, but it just wasn't getting any worse. So now, call the ambulance. Breathing was up and down, but it was stable. We went into hospital. They took me into hospital, and the experience I had at hospital, I have to say, from many other people, wasn't great. It wasn't great at all, but it's expected. I guess at this time during a pandemic, it is expected, but it frightened me, and I chose to want to come back home. They didn't give me a COVID test, although they kind of knew, because I was in the area of the A&E that was cordoned off for suspected COVID patients.
And had you had a COVID test beforehand? I mean, was it confirmed prior to going in? So I guess,
so during that week and a half, I think it was on the 7th day, I took a COVID test, was really unwell. I don't know how I took the test. So I did a home test, sent it off. It was during the Christmas period, so it didn't come back to me. And when it did, 6 to 7 days after, well, it was the 22nd to however many days it was. It came back and they couldn't read it. It would have been in the post box. It would have been cold. I don't know whether that affects your
Okay.
test kits
Yeah.
that you send. So I don't know whether that's something you could answer.
So
Because
did it not come up with a positive result? Was it inconclusive,
yes,
essentially?
it was
Okay.
inconclusive. It didn't come up with a positive test. So I thought, okay, that's fine. And then obviously on the when I had got my test back, that was when I had got my test back. It was, I've been in hospital already now. I'm out. So then we went to a centre and did it, me and my son. Mine came back positive, Adam's came back negative, which was crazy. We live in the same house, it's just me and my son. He didn't contract it, so that's something that's, you know, different. A lot of people, there is a lot of households, like I know within my family as well, like my sister's had it, my brother-in-law's had it, but the kids have been okay. So it's affecting people very, very differently. So that's where I was at. My recovery till this day, I can tell you that it's probably still affecting me. I do still get, the two main things are shortness of breath and tightness in my back and chest area. But that's only when I've probably gone up and down the stairs and I'm taking a deep breath and then I can feel it. Another thing I wanted to mention before we go on to the questions is it's affected me mentally. It's affected me emotionally a lot. And I think a lot of my followers have noticed how it's affected me emotionally and physically as well, definitely.
Yeah.
So
Yeah. So
that's
first of
where
all, I
I'm
just
at.
want to say, yeah, I'm really sorry to hear about your experience and what you had to go through. I guess it just goes to show that, you know, a young, otherwise, I presume, normally well, kind of fit
Yeah,
individual like yourself, who probably has no underlying medical conditions, and we don't need to go into all the details, obviously, but it can affect anyone. And even though we know that up to 80% of people who have COVID will probably have very mild to moderate symptoms, and then 15% may have more severe symptoms relating to sort of hospital admission, and then 5% may end up in intensive care. With the 80%, the majority of people will have a very mild illness, and some people may have no symptoms, as we know. But I'm really sorry you've had a really horrid experience. And as you know, there's a lot of things that you've raised there which were quite
yeah,
interesting, because you followed on with the symptoms that you had that suggests that you've got long COVID, which affects probably at least
yes,
half of people that have COVID. And, you know, fatigue, lethargy, shortness of breath on exertion, and even at rest can be symptoms of long COVID. So it's really kind of interesting you mentioned that, because it does reflect on a lot of people's experiences that I've come across as well.
yeah, definitely. I'm suffering, and I know that a lot of people are, even before. So I know a lot of people that have contracted it earlier on, or even like in September and October. Obviously, giving me words of encouragement. You'll be all right. You're gonna get through it. At that point, you know, when you just wake up and you think, why am I not feeling better today? And it just gets really worse until one day you do wake up in the morning and you're feeling on the mend again, alhamdulillah.
Yeah.
But no, I know a lot of people have concerns. Going into the questions now, perhaps a lot of
Yeah.
people have concerns of whether you've had it. If you've had it, can you get it again? And is it worse? Or, you know.
Okay. So, so in answer to that question, so if you've had it once, you can have it again. That's a definite yes. And
Yeah.
I've seen patients and people who've had it more than once. Generally speaking, in terms of if you have it a second time around, do you have it as bad? It's like with a lot of other viral illnesses. If you have another thing the second time round, often, not always, but often it may not be as bad, because your body's got a bit of a response to it and the symptoms may be milder. However, there have been cases when it's been much worse. And unfortunately, there have been cases that I've come across, not myself personally, but
Yeah.
you know, through kind of research and media, etc., that where one or two people have died actually a second time round. So it can be awful the second time round. However, generally speaking, yeah, first the answer would be you can have it more than once, and secondly, it can be worse, it can be better, but probably usually milder in most cases, we would think, if it
Yeah.
follows the pattern of most viruses and similar kinds of conditions. But yeah, I mean, it's really difficult, because you just don't know who's going to be affected and how adversely with the symptoms, because, you know, like we've said, you know, you're a young person who's otherwise well, but it can affect all ages and all different backgrounds, and that's why we have to be extra careful. And I
Yeah.
think, you know, you telling us about your experience and reflecting on that is really useful, because people will see it firsthand rather than going by, you know, certain conspiracy theories perhaps, or other things they read or come across online.
Definitely. Okay, so somebody here has said, how long does it take for your taste and smell to come back? So I'm going to answer that for you. I didn't actually lose my taste and sense of smell. My appetite went a little bit, but as it does when you have a general flu, it was everything else that was really, really bad for me. So maybe Dr. Quiz can answer that for you, timescale wise.
So medically speaking, it's along with a lot of other things, it's really unpredictable and variable. You'll have some people where the taste and smell sensation will come back quite quickly, maybe within a few weeks. Some people have it a loss of taste or smell several months later on, and I know people who've had the same issue. So it can be really variable. It can be difficult to predict. I would say with any of these things, and if any of this affects you personally during this live, and you're concerned about your symptoms, please do make sure you speak to your own GP or a healthcare professional who knows your history and who can go through things properly, because it's all well and good in us giving advice and go through things, and I hope it will be useful, but no one knows your history better than yourself and your own doctor and GP. Yeah.
Definitely. So another question arose, and somebody said that I've had COVID before. How long do the antibodies last, if any, in the body?
Okay.
And
so at this moment in time, the research suggests that it will last at least a few months, if not longer. Okay. The hope is that when you have the vaccine, it'll be even longer than that, maybe up to a year, but we just don't know. I mean, I think the answer to a lot of these things, as with COVID generally, we are learning a lot as we go along, and we just don't know. But there has been some research that's undertaken that shows that you have it for at least several months. If you've had COVID beforehand, and the vaccine should give you a much stronger response in theory.
Amazing. So, I mean, obviously, I'm back at work, but I need to go out and about in public. I'm being really cautious. I'm actually frightened to go out. I've now started doing shopping that's, getting sent to the home, because I am actually very scared. And when I go out, I'm wary of who's not wearing a mask and who's touching what. I'm being very wary and cautious. So I know back in the beginning, a lot of people did say, so, when the colder months hit in, we might get more cases. So somebody's actually asked a really good question here. Does that mean when the warmer months hit in, is it going to delay, or is it just not going to make a difference at all?
So generally speaking, with upper respiratory tract infections, of which this is one of them, so a viral-like infection that affects your chest, your throat, the nasal passages, these tend to be more common and prevalent in the winter periods when people are huddled closer together, so they can transmit more often. Colder weather, if that's going to probably have an impact or not. But generally viruses are circulating, perhaps more in sort of circulation as well. So we see more coughs and colds and chest infections and things like that in the winter. So that's why the winter was the time that we all feared, and unfortunately, we did have a lot of cases, we had a lot of deaths, and we had the biggest peak in the winter period in terms of observed cases and deaths and everything else that we saw along with that. So in terms of going into the summer, we would hope, if you look at last year as well, the summer, things did calm down considerably, but it's just so hit and miss, it's so unpredictable. And as long as we can all stick to the measures, as long as we all keep our distance, wash our hands, wear face masks and get vaccinated, inshallah, fingers crossed, things will improve this year.
Inshallah. So you mentioned vaccinations. One of the, I guess you get this all the time as a doctor on this hemisphere now on Instagram. So people must ask you, what is the best, AstraZeneca or Pfizer? Like, which one should I go for? Is there a better one for me? It's a question that arises time and time again. People are frightened to take this because there's, like you said, there's been online people that are not qualified that are giving out information that's not from the right source. So what can we say to them?
So first of all, with regards to misinformation and things online, there's this really good campaign that was happening beforehand, and that was saying that if you come across something online, whether it's YouTube or WhatsApp or Instagram, Facebook, wherever, just always pause for a second and find out where it's come from, who's actually created this video or article, are they actually suitably qualified, have they got experience, etc. Because unfortunately there's a lot of baseless information out there, but because it often triggers an emotional response, and you think, actually, do you know what, that makes sense to me, even though it may not actually be sensible or logical, it can often cause fear and anxiety. So always pause for a second and find, and always use reputable sources of information. With regards to the vaccine, so I've been really blessed, alhamdulillah. I've had both doses of my vaccine.
Okay, and how are you feeling? That's what people want to know as well.
First of all, I'm still here, no extra arms or legs, and I'm not transmitting text messages through my 5G connection or anything. So I just wanted to say, I'm completely fine. I had a bit of soreness after the injections, which is expected and understandable, I guess, but otherwise I've been completely fine. And I know not everyone has the same response. Some people might have a mild flu-like illness, a bit of aches and pains, or a bit of a temperature, and everyone's different. But generally speaking, from everyone I've come across, whoever did experience side effects, they only had it for a day or two, not for very long. When it comes to the vaccine questions that you've asked, so first of all, I would say that most people probably won't, unfortunately, get a choice whether they can choose
Yes.
between the Pfizer and the Oxford AstraZeneca one, because it all depends on supply and logistics and availability. So you probably won't get a choice of which one do you want. And if you did want to choose, or you were lucky enough to have a choice, you may have to hang around and wait. So you might even miss your opportunity, and it might be a while until you get your vaccine.
Yeah.
So my answer to that would be, if you get the opportunity to have a vaccine, you should go for it, because they've all been proven to be effective. They've all been proven to be safe. And the way they work, there has been studies done in thousands and thousands of people in the clinical trials. They've gone through all the rigorous processes that they would go through otherwise. And there's no answer in terms of what's the best one. Everyone's different. Everyone will react differently. The mRNA vaccine from Pfizer and Moderna is a bit of a novel vaccine. It's a bit different. It's a new idea, although in theory it should work really well. And the efficacy, the effectiveness is up to 95%. The Oxford AstraZeneca is a bit more of a conventional vaccine. It's a UK homegrown vaccine, so that might be a bit more reassuring. It uses a virus, an adenovirus, from a chimpanzee, and it's genetically modified to trigger a response. So they work differently in two different ways, but they're both safe and effective. And if you get an opportunity, I would just go for it.
Why are they holding human trials? I think that's in regards to the small dose that they're going to expose to the 18 to 24-year-olds. So I think the person wants to know, why are they doing that if they already know what is expected from having COVID from all the cases that have happened?
So in terms of the question, I'm not entirely sure if I understood it properly, but in terms of human trials, so first of all, they've undergone phase 3 trials in tens of thousands of people. So in the Pfizer trial, there's 43,000 people that they undertook trials on, and they've had data that's come out, and out of the 170 people who developed COVID, 162 of them had the placebo, didn't have the vaccine, and only 8 of them had the vaccine. So that kind of shows the efficacy and the effectiveness. So what happens with vaccines generally, and with a lot of medications, is once they're out into the market or out into the kind of real world, you have monitoring and you look out to see what happens, and you have this system where you can report side effects, and it goes back to the MHRA or the manufacturers, and they can keep an eye on things. And that's a normal process with any vaccine or any medication. So it's not like we're still being part of the trial. And I think some people think that we're kind of mass human trials at the moment, which I wouldn't say that's true, because it's undergone extensive, rigorous trials, as it would do with any vaccine. We're just kind of having the vaccine, because if you think about it, what's the other alternative? Do we have repeated lockdowns? Do we have face masks and social distancing forever? I mean, that could potentially happen for a lot longer unless we had a vaccine. So I wouldn't see it as an extended trial. I would just see it as at the next stage.
Somebody actually said, was COVID inevitable? As in history, there has been a pandemic every 100 years or...
This was going to happen at some point. And I think everyone, well, not everyone, but, a lot of scientists and healthcare professionals and people who study this would have realized that this would happen at some point. Whether or not to this extent, I don't think anyone may have realized. But if you look back at recent times, we've had Ebola, more so in Africa. We've had things like SARS and MERS in the Middle East and in the Far East. If you go further back, you've had like the flu, so-called Spanish flu epidemic, which killed a lot more people. And, every so often, as you mentioned, rightly so, there is a pandemic that happens. So what they were doing, in preparation, they knew that there was going to be a disease that would probably cause a lot of problems, and it was disease X when they're working on vaccines. So with the mRNA vaccine, for example, everything was ready, and they've been working on vaccine ideas and concepts for a long time. It wasn't just that it suddenly came about and the vaccine was produced all of a sudden in terms of the new concept. The theory was behind, the theory behind it was there for a while. But you're right. I mean, unfortunately, this could happen again. We have to be aware that this could happen again at any point in our lifetimes, although hopefully, inshallah, it won't. Not to this degree.
Okay, let's answer a couple of questions that are on here, because I don't want to miss them. Otherwise, we'll have to scroll for dear life. So I'm currently 27 weeks pregnant with no underlying issues. Should I be extra cautious?
So I think everyone should be extra cautious in terms of making sure that they adhere to the rules that they've been given. Obviously, if you're pregnant, you need to be careful, because especially towards the end of the pregnancy, I mean, you're 27 weeks, so you're not quite there, but if you're towards the end of the pregnancy, even more so when you're about to deliver. But I think just be cautious for everyone. And with the vaccination, unless you're a high-risk individual, like you've got underlying medical problems, you're a frontline healthcare professional, in pregnancy, it's not generally routinely recommended. And it's not because it's not safe, because they don't necessarily do trials with pregnant women at the beginning anyway. So it doesn't mean it's not safe, it's just that it's not recommended unless you're higher risk. So the vaccine, you can discuss that with your GP if you are higher risk, but otherwise I would just say stay safe like everyone else.
Another question here. Hi, I'm still recovering from COVID, probably from the same time as Rahila. But with me, I feel like my bones really hurt. Yeah, definitely. Especially in my legs, more worrying, my teeth have started chipping. So is that something to worry about?
So, I mean, obviously, with a personal medical issue like that, if it is really troublesome, do make sure you seek personal medical help from your own GP who can go through a more detailed history and assessment. But in terms of a general rule, I mean, I'm not sure what your vitamin D intake is like, but vitamin D deficiency is common anyway, especially amongst people from Black and minority ethnic groups, or Asian groups, or Black groups. Vitamin D deficiency is extremely common in the winter period, especially.
Yeah.
So the government have advised that everyone, irrespective of ethnicity and background,
Yeah.
should be taking at least a low dose vitamin D supplement over the winter
Yeah.
period, because you need sunlight to make vitamin D in your body.
Yeah.
That one of the main symptoms, if not the main symptom of vitamin D deficiency, is general aches and pains. I mean, it can affect a whole lot of systems in your body and cause a whole lot of different symptoms. But one of the main main symptoms we see is aches and pains. So if you've got general aches and pains, I would probably think about your vitamin D levels if you haven't already got that checked.
So someone actually said she's worried about the fact that the vaccines were developed so quickly. And I think a lot of people have been, you know, because we're not professionals, so we don't know how long actually it really takes to develop vaccinations. So what can you say in regards to that?
Okay, and I think, you know, vaccine hesitancy is completely understandable. You know, a lot of people are apprehensive about the vaccine, and that's very understandable. You know, this is a new thing for a lot of people. People aren't aware of how long it takes, as you mentioned, for a vaccine to be produced, and you know, people are worried about the situation generally. So that's completely understandable. And what I would say is with these vaccines, as I mentioned before, you know, the technology, the theory has been there for a long time. The templates have been there. You were just looking for the genetic code essentially for the virus, and that came along, and that was sequenced really early on. In terms of the fact that, you know, people say, oh, it takes 10 to 15 years to produce a vaccine and it was produced so quickly. Well, we have to think about, you know, what happens in those 10 to 15 years. There's a lot of bureaucracy, a lot of red tape. You have to apply for funding. You don't have lots of people working on it like you would have done in the last year. So you have to think there's so many scientists, so many clever minds working together on, a thing together, a project together, the vaccine. You bring all these people together. The governments have allowed, you know, to get funding quicker. Pharmaceutical companies have managed to get funding quicker. Plus, one thing that's really important with vaccines is you need people who are unwell with that condition to kind of have the vaccine or be tested in clinical trials. The thing is, with COVID, there were so many people available that you managed to get, you know, 43,000 in the Pfizer trial really quickly. So there's a lot of things that we have to consider, and it still has gone through all the same rigorous processes. We have to believe that. And I personally haven't been worried, and I'm talking from a sort of scientific and healthcare professional background, I hope. And I've had both doses, and I've been fine.
Okay.
So please try not to worry, and please just make sure that, you know, do your own research by all means, but always look at reputable sources of information.
Emily has said she's still suffering from fatigue after 3 months of having COVID, very weak and getting easily out of breath, even talking. Even me, I'm not a professional hearing that. I'd say definitely contact your GP if it's been that long. Obviously, there is something as long COVID, and a lot of people put in my inbox after I said I'm not getting better that I'm possibly having long COVID symptoms. So yeah,
I'd like to add to that. So definitely please speak to your own GP, because what they can do is they may be able to signpost you to clinics that are happening now in various places where you have long COVID clinics, even in some areas where
I didn't know that.
Yeah, so hopefully that's a learning point for yourself.
That's what I'm going to be doing tomorrow now.
Yeah. So I mean, I'm not saying it's available in every single area, but certain areas are having long COVID clinics where people, you know, unfortunately are suffering with fatigue or breathlessness, as we've discussed beforehand. So if that is something that is bothering you, please make sure you speak to your own GP, because they may be able to kind of signpost you or refer you to the relevant clinics, or they may be able to kind of signpost you and refer you to relevant resources online. There's lots of good information like that online.
Somebody said, is the vaccine okay for women who want more kids in the future? So I think there was a lot of people online that were saying it might affect your fertility, and people have gotten really scared because of that. So yeah, over to you.
Okay, so I just want to clarify that at this moment in time, there's no evidence that these vaccines cause infertility. There's no evidence of that. And I'm saying that from a healthcare professional background, but also if you look at the Royal College of Obstetricians and Gynecologists, who are the kind of college that look after that side of things, you know, pregnancy and, you know, childbirth and everything, their president, I think his name is Edward Morris, he came out and made a clear statement on the RCOG website. So if you Google RCOG, these are the people who look after this and deal with this every single day. And they came out, and also I think it's the chair of the RCM, Royal College of Midwives, they've come out and said that there's no evidence that it should affect fertility. If you look at the WHO, the CDC, the NHS, all the reputable organizations have come out with the same thing. And I mean, a lot of people come back to this protein, which they think it will mimic, but then surely COVID, the coronavirus itself should have mimicked that protein. It's associated with the uterus, the womb, and the placenta itself. And if it were to do that, then you'd think, hang on, why aren't so many people who've had COVID becoming infertile? And that's not really happening. So the vaccine shouldn't cause that.
Can animals contract COVID and can they pass it on to you? They're afraid because they've got pets at home, I guess.
So the current theory is that, you know, this strain of coronavirus probably came from animals. I mean, whether it's pangolins or bats, where it's just not clear still.
Yeah. From the beginning, yeah.
Yeah, from the beginning, right from the beginning. In terms of the fact that, you know, we know there's at least a few strains of coronavirus, probably at least 4, that affect humans anyhow, before, you know, this one. And in terms of coronavirus affecting other animals, yeah, it does affect other animals, but there's different strains. In terms of this SARS-CoV-2, which causes COVID-19,
yeah.
I think it's unlikely that there'll be animal to human transmission. If you are concerned, please speak to your vet, because they'll be able to kind of help you more about that, I would say. So if you're concerned that your animal has got symptoms that suggest that they may have COVID or are unwell, please speak to your vet and they'll be able to advise better.
Does eczema count as one of the high risk groups? So I'd categorize that as any kind of skin condition.
So eczema is a really, really common skin condition, one of the most common skin conditions, and we see it all the time. Unless you've got really severe eczema and you're on oral steroids or you're on immunosuppressant medication, I think if you've got very mild to moderate eczema, it probably wouldn't count. In fact, it wouldn't count. And there's a list of conditions on the government website. So if you search gov.uk, they've got a list of all the conditions that are higher risk. And it's usually conditions that are more affecting your systems, and the fact that you might be on certain medications which might make your immune response a bit weaker or might affect your immune response. So eczema shouldn't cause that unless you're on very strong medications. And then if that's the case, you should speak to your GP. But if you are someone who's extremely clinically vulnerable, you should have already had a letter saying that you're eligible for the vaccine.
Okay, so that answers that. Someone actually asked, what would you say to the BAME community who are afraid or not taking the vaccine?
So I would just say, you know, it's really unfortunate that there is a lot of misinformation, more so perhaps targeted at the BAME communities, because unfortunately there's a lot of there's reduced uptake amongst Black and South Asian individuals, generally speaking, of the vaccine, and which is ironic because we tend to be more affected. People of Black and South Asian origin or ethnic origin often are worse affected in terms of hospitalization and even death. So I think it's really unfortunate, and it's ironic that we're not taking the vaccine yet we're worse affected. And all I would say is, you know, just please make sure you read reputable sources of information and listen to the healthcare professionals, listen to the scientists, and it's there for your benefit. And if you're eligible and you're okay to have the vaccine, I would definitely go for it, because it'll give you protection. I mean, I've had it, my parents are having it, my family members will all have it. And I wouldn't be giving it or offering it or even suggesting it to them if I thought it was harmful. I mean, I would never do that to my family. So hopefully that kind of resonates with you.
As a doctor, do you think Boris had tracked the whole pandemic appropriately?
I think anyone would have found it challenging and difficult. Obviously, there's been a lot of mistakes, a lot of U-turns. And if we look at other governments like New Zealand, Jacinda Ardern, for example, she's managed it impeccably. She's been really good. Yeah. I think anyone would have found it difficult, but yeah, there's been a lot of mistakes and a lot of things could have been done differently.
Okay. Could you explain why vulnerable people who have been vaccinated are still having to shield? I'm going to leave that with you. I mean, I think I know the answer to that, but you're the professional, so can you please answer that?
So that's a really important question, actually. It's a really good question. Thank you for asking that. So essentially, once you've had the vaccine, it doesn't mean that you can just go out and do anything you want to do. You still need to wear a face mask. You still need to wash your hands. You still need to socially distance. And the reason for that is because, yeah, it does offer you a degree of protection and hopefully a high level of protection. But there's always that chance you may still get COVID, you may transmit it to other people, and you may still become unwell. So it's really important that even though you've got that level of protection, until we have a high level of protection amongst everyone, and that means that's why it's so important to have as many people as we can vaccinated, until we have a high level of protection amongst everyone, then it's still not as safe as it could be, because COVID's still going to be circulating, or, you know, SARS-CoV-2 will be circulating.
There's another question here. Do you think the government let the frontline workers down with the lack of PPE? That's directly to you, definitely.
Yeah. So at the beginning, especially, you know, there was a real lack of PPE, as we all know. I mean, it was highlighted quite widely in the media, and things have improved significantly, obviously, since then. It's been a while, so things have improved.
Yeah.
Unfortunately, I do feel that that may have had an impact on people. You know, at the beginning, I don't know if you remember, but a lot of doctors, a lot of healthcare professionals did pass away early on with COVID. And it's because you think about people in, you know, positions like mine, we're exposed to it all the time. When we see sick people, and we do still see people, you know, it's not all, I mean, a lot of it is done by remotely, you know, telephone consultations, video, but we still actually physically see people, and you know, these people will have COVID, they'll be coughing, they'll be breathing, so they can transmit it. And unfortunately, when the PPE isn't adequate, that puts you at even higher risk. So that did have an impact, I think, early on, but less so now, I would say.
Why has a first world country like the UK got one of the highest levels of deaths in the UK? And I've questioned that before, and I know a lot of other people are questioning this too, compared to other countries.
So if I'm completely honest, I think we won't know for sure until maybe a few years down the line when they do retrospective studies and they look back at all the data, because right now it's difficult to tell, and it's really hard to compare one country to another. But yeah, if you look at the UK, the US, you know, we've had two of the worst amounts of deaths. I mean, you've got other countries like Brazil and India who've had a large number of deaths, Mexico. But there's so many different factors we have to think about. There's biological, there's social, there's psychological, there's so many different things that we have to think about. You know, social mobility, some people maybe not adhering to the rules, the fact that there might be a high number of medical conditions, a lot of people living in urban areas, deprivation. There's so many different things we have to consider. And I think once they do retrospective studies or they look back at the data in a few years' time, we'll have a clearer idea.
Yeah. Okay. So somebody has that said, are you confident in sending your children back to school? I think it was 8th of March.
So I've got 3 young children between the ages of 2 and 7. And so 2 of them are, one's at school, one's at preschool.
Okay.
And they're not actually in yet. I mean, even though I'm as a key worker, I could have sent my kids in, I haven't sent them in since the lockdown. So I would say, let's see how things go. Things are definitely improving. Alhamdulillah, you know, things are definitely improving in terms of case numbers. If you look at the data, and I don't know if you've seen, but on my stories every day I put up, regularly I put the data up. And so if things are improving, I'm always putting up updates. But, you know, we don't know what's going to happen in the next couple of weeks. I would suspect things continue to improve. So by the time it's March the 8th, you know, case numbers will be lower, deaths will be lower, etc. And if that's the case, then yeah, if I've had the vaccine, my parents have had the vaccine because my parents live with us, then I would feel a bit more reassured. But I would assess the situation at that point. And everyone's situation is different, so we have to appreciate that.
Let's finish on one question. If our elders are listening to this right now, what advice would you give them in Bengali?
So I've actually done a few Bengali videos, and I put a few Bengali videos on my profile as well, not just from me, from other people as well. So if anyone's interested, feel free to have a look, because they're probably much better than what I would do right now, spontaneously. But it's the same thing really. You know, all the protective measures we mentioned. And if you want me to say it in Bangla, I'd have to probably do it for another time, and I can do that, and I'm planning to do another video actually.
You should do a video. I have seen the video online actually. I think there's another one you posted of a gentleman and his mother. I think that what she said was just so precise. It was amazing actually. So yeah, you can have a look at that. If I find it, I'll post that onto my stories as well. So then you can show it to your parents, then give it to your WhatsApp groups and so forth.
That was quite a nice video from an elderly person.
It was, yeah.
It was really sweet actually. But I would just say, I mean, there's all the usual things that we would say in English. And I am planning to do a few more videos in Bengali, because I always get asked this to do that.
Yeah, I think you should.
Take the time to do it, as you can imagine. But I have got other Bangla videos on my profile, so feel free to have a look if you want to.
Definitely. Well, thank you so much for joining us today. I think it's been really insightful, even for me. I mean, I've gone through it, the systems, and I'm still feeling the effects of it. And it's been really insightful for me. I'm not a professional, so people like yourself are amazing for us now in the community. And we thank you for being there and saving our lives, and, you know, just continuously working, because you're at home now, you should be relaxing, but I'd class this up as working, because you're educating people and you're trying to save lives. So thank you so much for joining my live. Is there any last words you'd like to say before we head off?
First of all, thank you for having me, and thank you for organising this, and thanks to everyone who's joined in as well for all the questions as well.
Yes,
sorry we didn't get to answer all of them, I think, but hopefully we did. And if not, I mean, both of our profiles will have videos and links,
Yeah,
etc. So feel free to have a look at both of our profiles if you'd like to.
definitely.
But thank you,
Right.
and I hope it was useful.
Yes, it was. Thank you very much. Thank you.
Thanks.
Bye.